Welcome back to the channel. I'm Vinay Prasad. I'm a practicing doctor and professor of epidemiology, and over the last week I've been pretty busy. I've been to Stanford University for Health Policy Forum on COVID-19, and I went to Emory University in Atlanta, where I spoke with Dr. Carlos Del Rio, their chairman of medicine, on masking mistakes, COVID-19 pandemic mistakes. I want to reflect on both of those two experiences. I've got some other things in the news from Santa Clara County, and just some other things that I've seen this week. And I thought I'd just do a single video, talk about all the things I wanted to talk about. All right. So the dam is breaking. That's right. The prohibition at universities for talking about COVID-19 policy is finally lifting. You know, I always make this point when I talk about this, which is that I am a professor in the Department of Epidemiology. To my knowledge, my university, nor any of the top universities, they held zero debates on school closure, on masking kids, on vaccine mandates. Zero debates were held by these top universities during the pandemic. What does that say about a university's role as an arbiter of academic and policy ideas that they were absolutely unwilling to debate those topics? They were unwilling to debate those topics, not because there wasn't a debate. Obviously, we know people felt differently about schools. Should they be closed or open? And should there be mandates or not? And should you force little kids to mask or not? They didn't have any debates because they're too scared to actually give voice to these debates because they don't want that peanut gallery, the gallery of extremists, the cancel culture gallery, to come attack them. And so they just completely abdicated their role in the public sector, and they gave it over to podcasts, so people can complain all they want about Joe Rogan, but at least Joe Rogan had people on who actually had different ideas, not universities. They didn't like that. Well, that's finally ending. Stanford University a couple weeks ago, Emory University last week, they are starting to have the conversations we should have been having all along. And I was fortunate enough to attend both. So first at Stanford University, my friend and colleague Jay Bhattacharya, he ran it, and it was even had an opening from the Stanford president, who I think spoke rather eloquently about the need to have these dialogues, and maybe a little bit remorsefully about how Stanford, because they're completely insane, they censored Scott Atlas for saying things that were pretty much true. Scott Atlas was pretty much saying things that were true on TV, but they censored him as a professor because a bunch of panicked people didn't like what he had to say. And he was standing too close to Donald Trump. Those were his two greatest crimes, I think, that they saw. And so they censored him. And the president apologized for that. And I think John Etchemandy, the provost, has already apologized for that. Well, there are lots of things we discussed at that conference, and there are 4 panels that now appear on YouTube. You can go find those. I'm in panel 3. My panel was about global mistakes. I spoke a lot about how the COVID-19 pandemic response, not the virus, let's be very clear about that, not the virus, the response has completely shattered low and middle income nations globally on 2 key issues. 1, poverty, which has risen, and 2, on education. We had finally started to meet some of these very modest goals in terms of providing a basic elementary and grade school education to so many of the kids in the globe, and those goals have all been eroded by the pandemic response, which kept those kids out of school for no good reason. Yeah, actually for no good reason, because kids in school doesn't contribute to regional spread. There's a number of epidemiologic papers to show no contribution at all, or very, very tiny contribution. Anders Tegnell says, "We knew this disease was not spread by kids," end quote. That was from Anders Tegnell, of course, led the Swedish response. So it didn't slow the spread in communities. And of course, all the kids got COVID-19 anyway. They just got it. And the lion's share of them had not gotten vaccinated before. That would have happened to them, and they could have gone to school if we had allowed schools to be open. But we didn't, because the people who are setting our policy were completely off the mark. So I talked about those 2 things, poverty and education. And I speculate, but it's kind of a pretty realistic estimate, I think, that the losses in terms of years of life lost. So what's years of life lost? If somebody was supposed to live to 92 and they die at 90, they lost 2 years of life. If you're supposed to live to 80 and you die at 8, you lose 72 years of life. So one way to sort of measure the impact of a disease or a response on the community is to tally up all the years of life lost. Of course, that acknowledges that a 17-year-old who dies is losing a lot more life than an 88-year-old who dies. And I estimate that in terms of years of life lost, just closing schools alone, that's going to result in 10 or 100 times as many life year loss as the entire COVID-19 pandemic. Of course, the pandemic killed millions of people, but the years of life lost from school closure, And all the sort of suffocation you've put on those kids and their entire upward mobility, their life course, that's going to dwarf COVID-19 10 or 100-fold. In other words, school closure was the biggest fiasco, biggest failed public policy decision probably made in the last 100 years. At Emory, I spoke to Dr. Carlos Del Rio. He's an infectious disease doctor. I think he was been past president of IDSA, and we had a very spirited debate. This video does not yet appear on YouTube, but I think it might. I think everyone has signed off on it. It's going to come, and we're going to make that video available, and I think you'll want to listen to that discussion. So I wrote a Substack article, and by the way, if you're watching this video right now, you need to do a few things. One, you need to follow me on Twitter because I say things there that I don't say elsewhere. Two, you need to follow me on Instagram because I post some reels and Z-Dog is posting some reels of stuff we're doing together. That's another place to follow me. Three, you need to subscribe, either free or paid subscriber, to Vinay Prasad's Observations and Thoughts. That's my Substack. That's where I tell you what I'm thinking about. You can also subscribe to Sensible Medicine, which I run with my colleagues, and the Drug Development Letter if you actually are one of those people who follow me who actually cares about cancer drug development. We've got some good articles coming there too. So, on Vinay Prasad's Observations and Thoughts, I talk about 6 points that Carlos Del Rio and I discussed. One, school closure. I think Del Rio's position is that prolonged closure was a fiasco. Completely agree with him there. The difference is he thinks that an initial early closure was an acceptable error, and I don't think it was acceptable. And I think the question is, knowing what you knew at the time, would you have closed elementary schools? And people like Carlos Del Rio and many others would say, well, we just didn't know enough. And so if you don't know, be precautious. Do the precautious thing. Except that argument is undermined by two arguments. One is that somebody did seem to know something. Somebody did seem to know. His name is Anders Tegnell. And he never closed schools in Sweden for under 12, ever. He never closed schools, ever. How did he have a different conclusion? I spoke to him at Stanford. And the answer is that he actually reviewed the data on the ages at which people died in Wuhan. And he saw very clearly that there was very little risk in children. He also reviewed the data on the cases who had been diagnosed with COVID-19 in Wuhan, who was actually sick with it. And again, nearly no children ran that data set. So with those two facts, Anders knew this is not a disease that's targeting kids and we shouldn't close schools. And in fact, that is the precautionary principle. You know, out of precaution, we should close schools. Whoever said that's out of precaution? Out of precaution, we should just keep things going in the way that sustains the global economy. And only if you have really good evidence to sabotage children should we close schools. You know, that's the way he viewed the precautionary principle. Out of precaution, you should let the kids have their futures. Not out of precaution, you close the schools because you might kill grandma. He viewed it differently, and I think it's a fundamental distinction. Two, my second piece of evidence that that decision was incorrect at the time was that if the policymakers had just read the pre-pandemic guidance from D.A. Henderson and others, they would say very clearly that D.A. Henderson in that guidance specifies that we should not close schools unless, we should only consider it if there's a virus that's expected to have 1 million fatalities of kids in the next year. Then we can consider it. We knew even from the bogus, disreputable Imperial College London modeling that you were not going to get near that number, okay, for kids, ever. We only got maybe about 1,000, 2,000 kid deaths. Even that number is probably overstated because no one has ever provided, of those 2,000 kids who died, how many were actually healthy children who didn't have comorbidities. That's not to say that it's unimportant that kids with disabilities die. That's tragic as well, but it puts the risk in perspective. Should a parent of a healthy child ever had worried at all? Does that kid have any risk of death? Should that kid get any boosters or any vaccines? That statistic has never been adequately reported. So we were about 1,000 times, less severe. The virus was 1,000 times less severe than the kind of virus D.A. Henderson envisioned considering closing schools for. So in other words, they shouldn't have considered it at all. So that's one disagreement. Two, Del Rio and I both agreed pretty heartily. You'll watch the video and you'll see that the current CDC, because they keep pushing this recommendation to vaccinate everybody, even kids who don't need it, and boosting babies who don't need it, they're very likely to lose trust in all vaccines generally. And I think they're complete idiots at the CDC. It's an agency that's run by complete idiots. I don't know how they even have the courage to show their face after the pandemic, because they said you should put a 2-year-old in a cloth mask except for when they nap side by side in the same room in the daycare. Anyone who says that, you don't even need to go to school, as my friend from Switzerland told me. You don't even need a grade level education. No, that's a stupid policy. And yet they said it and they mandated it. So I do think there needs to be mass firings at the CDC. Anyway, we both agree that the CDC policy is wrong, but I'm sure Carlos doesn't agree that they should be fired, and he probably thinks they were erring on the side of caution. But we actually didn't talk about that enough in the debate. I don't think even he would let him off the hook. We disagreed a little bit about long COVID. I think one thing I completely agree with is that medicine has a long and disreputable history of not taking people seriously when they complain of ailments, and that's true. 2, I do think there are people who've gotten sick with COVID who have long-term sequela. Post-viral sequela has always existed for all viruses. You don't always feel 100% right away. 3, some component of it is a psychosomatic component. Some component of it is psychological. Let's be honest. There are many, many data sets that show people with pre-existing anxiety and depression have it, and it doesn't even matter if you had COVID before. If you have a data set show you that, some component of it has to be psychosomatic. That doesn't mean it's not real. I think that's a fallacy. Psychosomatic disorders are not unreal. They're real. They're really bothering the person. It just means that instead of reaching for Paxlovid, you might reach for serotonin receptor uptake inhibitors. You might reach for an SSRI. And in fact, we now have some randomized data that Paxlovid doesn't do jack shit for long COVID. Duh, because obviously it doesn't do shit for COVID anyway, so why would it do shit for long COVID? It only worked in one trial, EPIC-HR, which excluded pretty much everybody in America who ever got it. People who had been vaccinated or already had COVID. It only looked at high-risk, unimmune people for a strain of the virus that doesn't exist anymore. Side note, of course, I really get annoyed with that because, to me, why do I always get annoyed with how the Biden administration pushed Paxlovid? Like any administration full of incompetent people, they purchased billions of it without even knowing the results of the study. That's something only an idiot would do. I mean, why? You don't have to have much education to know I will buy your drug when you show me it works, rather than I'll buy your drug before you ever showed me it works. Then, once they bought it all, they repeatedly ignored the evidence that showed it didn't work, and they just pushed it relentlessly. And I can't prove this, but I suspect the reason they did was they knew there's just a group of, what was the pandemic? We cranked up the panic. We got you all worried. And then we got the vaccine, and then they said, another untrue statement that if you get the vaccine, you can't get COVID. Of course, very quickly they learned that you could. And then they realized, well, people are still going to be scared because even with the vaccine, they're going to get it. So they're not going to go out there and work and do their jobs. Well, we'll have to sell them this false hope, this Paxlovid hope, and that'll be our way to get them moving. So I suspect that's why they pushed it so hard, that and the fact they'd already spent all this money. But very clearly, it has no evidence of efficacy in people who've had even one dose of the vaccine, people who've had COVID multiple times, no evidence of efficacy in people who, against prevailing strains. The evidence is from earlier strains, and so we have a meta-analysis on this now out in a peer-reviewed journal. Yes, see, unlike many of the nitwits on Twitter, or on YouTube and Twitter and anywhere, who are doctors who make YouTube videos, I don't see them actually doing any scholarship. I think I've published 25 plus peer-reviewed papers in COVID-19, many more to come. Oh, including the one in the Annals of Internal Medicine last week. Oh my goodness, I can't believe, I should make a whole video on that. That's a good topic. The long story short is, there was an analysis by a group from Boston that said that masking kids slowed spread in Massachusetts. And we reanalyzed those data on the Annals of Internal Medicine, which is, I think, the top 3 or 4 journal by impact factor. And we showed that the entire conclusion is spurious and that New England Journal paper should be retracted. That paper is so brutally debunked, I'm surprised it's not retracted already. If there was any sort of level playing field on these topics, that paper would have been retracted a month ago, okay? It would be retracted even before people saw our publication because we obliterated so badly, and we published on preprint server. Okay, the fourth point. The fourth point is Dr. Del Rio thinks that public health training, MPHs and the like, need some component of communicating with the public. Like, we need to teach the average public health doctor how to be a better and more persuasive communicator with the public. Well, the best way to teach that probably is to make them watch some YouTube videos, because the way academics talk makes me want to die. It really does make me want to die. I can't listen to them. The way YouTubers talk is more optimized for the delivery and retention of engagement. And I guess this is the way I talk. I always talk like this. But I'm sure that the way I've talked has been influenced to some degree by YouTube and watching a lot of YouTube. And somebody could actually pull some audio tapes or videos of me talking 10 years ago and now and see how I'm different. I probably break up my ideas a little bit more, and I probably enunciate better, and I probably get to the point clearer. And I'm much less likely to say and like and all those filler words that make you want to stick an ice pick in your head when you're listening to someone talk. So I think if they wanted to do what Carlos Dobrev proposes, they should learn from YouTube. But here's where we disagree. I wouldn't teach the average public health doctor communication skills because I think the average public health doctor should just shut up, should not actually communicate to the public, because if you're not actually going to read the literature yourself and think about it yourself and have experience analyzing and being critical of data, then you really shouldn't be just, listening to CNN and parroting it in your public health conference. I think the caliber of training in public health for science and evidence appraisal is piss poor. And sadly, no one's going to like to hear this, but public health does not recruit the best and brightest. It absolutely does not. Why wouldn't it? Why would it? If you don't, no field that pays horribly for decades, as this field has, will ever recruit the best and brightest. They're going to go to AI and, they're going to go to economics. They're going to go to fields where smarter people go. So what's my point? My point is that it's sad that public health officials, most of the time, they're, in the backdrop of life, and it doesn't matter who has the job. But every once in a while, it's really important to have someone good. And then when that moment happened, we just didn't have that many good people to do it. And they may not like that, but if any of them were good, they would have deviated from some of these clearly delirious policy choices and said something, and very few of them did. Most of them went along with whatever the narrative being piped out of CDC was. And we're going to learn more about that in Santa Clara when I talk about the next topic. So I just think most people in public health should be taught to keep quiet, and probably not communication. And my last point, you can read my article for more points. My last point is that it was really good that Emory had this debate. It really brings these issues into the forefront. This is Emory. It's the town with the CDC in it. It's really important that they are giving voice to these kinds of concerns. There's probably some people in the CDC didn't want to come and hear this dialogue because they're weak people. I think that if you're not interested in a topic and you don't want to go, totally cool. If you're interested in a topic and you don't want to go because you disagree with one of the two people speaking, you're a really weak person and you need to look in the mirror. You need to toughen up. Speaking of toughen up, I have a little side note on toughen up. Somebody asked me recently, do I believe that vitamin D and zinc and vitamin C and some cocktail of these things help you if you get COVID? Like if you get COVID, should you rush out and get your mixture, your medley of ivermectin, vitamin D and thing? And the answer is no, I don't think it helps. Why? Because, there's a bunch of randomized studies. Some people are correct that some of those randomized studies use high dose or started late. Guess what? That happens all the time in medicine. There's a randomized study that uses a dose you don't like or starts it when you don't like. You know what we do instead of crying about that? You have to run a randomized study that starts it when you want it at the dose you want it and prove that it works, okay? Vitamin D and zinc and all these kinds of bullshit supplements, they have been tested in thousands of randomized studies, and they just don't. If you look at a portfolio of everything, they just don't work. They don't do shit, okay? And the other thing about it, the toughen up part is, it's just a cold, okay? If you have COVID, it's just a cold now, particularly in 2024. You just need to drink some OJ, rest, and toughen up. You don't need a medley of whatever. You don't need to wear a mask and all this stuff. You don't need to test yourself to figure out what it is. You don't need a Paxlovid. You don't need a 25 boosters a week. You don't need any of this stuff. People have had colds for millions of years. They're going to have colds for millions more. You don't need to do anything. You just need to rest, sleep it off, toughen up. I really think that people need to toughen up. That would have actually improved the pandemic response a lot. If people had a toughen up mentality, they wouldn't have closed schools. They would be like, well, it's not that harmful for kids. In fact, IFR is lower than influenza. If they get it, it's unfortunate, but you got to toughen up. They're going to get it anyway, which they did. That would have been the answer. And that's what Anders Tegnell realized very promptly in Sweden. Masking. These public health officials, by the way, who Carlos would have better communication skills. They've actually re-implemented mandatory masking in Santa Clara County, okay? And the state of Maryland has last year has a mandatory healthcare mask mandate, but they're starting November 1st through March or April in Santa Clara County. Everybody in the hospital over the age of 2 has to wear a mask in all places, like the gift shop and the like. I mean, what am I to say? This policy is obviously stupid. The first thing to say is that there's just simply no evidence that this policy, November 1st to April 2nd, or whatever the hell it is, actually will slow the spread of respiratory disease in the hospital, in the community. They have no evidence to support any of their claims. Also, the second thing you'd ask is, well, why should it be November 1st, not October 15th? Or what shouldn't have been the summer when everyone actually had COVID just now? These are additional questions that also have no evidence. The third point I'd make is, the person who set this policy is obviously an idiot. I mean, they're a complete idiot. They haven't been paying attention. They don't know where the pulse of America is. The pulse has moved so far away from this. They can only get away with it in a region of the country where there's still so many people delusional that they think that this would be beneficial. In other words, you know the place, the hospitals that can get away with this stupid policy if you go to the airport gate for that city and you see more than 4 people wearing a mask, because that's the delusional city that can get away with it. You go to Houston, New Orleans, get the hell, nobody wearing a mask in New Orleans, okay? But San Francisco and maybe suburbs of Boston, I'm sure they're going to implement something silly like this. The DC Beltway area, I'm sure they'll do something like this, okay? It's a stupid policy, has no evidence. I mean, I've said before, it should be illegal to implement these policies and not generate evidence and make them year over year. The person who said it, of course, I do think is an idiot. And there's just no kind word for what they are, because I just don't think they can't be that smart. Okay. Joseph Marine, who's a cardiologist, he wrote a brilliant article in Sensible Medicine. It's called Masking Mistakes, Fall 2024 edition. And he has 7 points. Number 1, forced masking creates an inhospitable environment for workers, patients, and visitors. Seeing faces is natural and necessary for human society to function. This is like kind of obvious stuff he's saying, but that's a great point. 1, it's inhospitable. 2, it sends a false signal to the public that healthcare facilities are dangerous. The gift shop of a hospital is no more dangerous than going to the mall, okay? Forced masking is demoralizing for many healthcare workers who see it as ineffective. Yeah, people who know it doesn't work. It's demoralizing to know that a nitwit is controlling what a highly educated doctor has to do. Truly. Forced masking will exacerbate the healthcare workforce crisis. Most people would rather not cover their face, and some people will move elsewhere. Of course, nobody wants to work in a Santa Clara County hospital. Also, the cost of living is through the roof anyway, so you're better off going to a place where that's a little bit better. Also, the taxes are through the roof, too. Forced masking will undermine public confidence that healthcare decisions are based on science and reason. Most people believe that mask mandates are not. Yeah, well, I guess in that point, I'll push back a little bit subtly on Joseph Marine and say there's lots of shit in the hospital that ain't based on science or reason. That ain't new. So it is, to be fair, one of many, a panoply of things they do in hospitals that don't make sense. For instance, the PPD that I have to take every year, that's a pretty brain dead thing. I've written a paper on that. All the gown and glove dress I have to wear all the time when they swab someone they shouldn't have been swabbing, and then I have to wear this contact precaution. That's also not evidence-based. We have multiple randomized control trial star ICU bug. And pretty much all of the modules I train on, the module that says, if you see somebody's medical record, do you A, post it on Facebook, B, put it in the shredder? These kinds of modules that waste my time, not evidence-based. So, So I push back on Joe Marine and say it should teach the public that hospitals are run by nitwits. Mask mandates make no distinction between effective masks as the N95s and a piece of cloth with ear loops. Well, that's a good point. They never really have made that distinction. There's still somebody wearing a fucking bandana or whatever, some sock they cut up in 2020. Forced masking undermines medical scientific progress. Those who would implement health interventions, especially coercive ones, should conduct high-quality studies. Yeah, Joseph Marine is spot on. Okay, I'm going to close this video. This has just been a medley of things that have been on my mind lately. But I got to say one thing about this plagiarism, which kills me. So they've looked through Kamala Harris's book, and they find all these passages that are clearly plagiarized. And then the New York Times asks a plagiarism expert, an expert in plagiarism, do you think that this is plagiarism? And he has some sort of quote that says, it's no big deal, it's no big deal. And then on Twitter, he says, well, they didn't show me all the examples. Okay, here's what I want to say to the New York Times. Are you stupid? You don't need to be a fucking plagiarism expert, okay? You just need eyes to look. It's the same fucking text. There's no such thing as a plagiarism expert. You don't go to school for 25 years to read the same fucking sentence. It's the same fucking sentence. Are you so stupid? You don't need an expert. Anyone can look at these passages and they're copied verbatim. That's not a fucking coincidence. That's plagiarism, okay? This fucking expert in plagiarism. Is there an expert to tell me the two balls that are red are the same color? Is that an expert? You need an expert to tell me the difference between a basketball and a football. The shape is different. I don't know. Let's get the expert. You don't need experts for fucking obvious things. So stupid. Yes, she obviously plagiarized. Now, does that matter? I don't know. I'm an academic, and I happen to live in a world where people actually give a shit about that. But somebody made the point that, well, somebody said, she didn't plagiarize. The person who wrote the book plagiarized, and who the hell knows who that is? And I was like, yeah, that's true. When you hire your ghostwriter, get a ghostwriter who don't plagiarize. I doubt any of these politicians wrote any of their books. It is what it is. I mean, it doesn't have to change how you vote or whatever, but at least let's be honest that is a lot of plagiarism, okay? Plagiarism is copying text. You don't need to be an expert to see it. It's fucking obvious, and she did a lot of it, or whoever wrote that fucking book that nobody wants to read, okay? Which, by the way, I'm sure it's a god-awful book that I would never want to read. I don't think there's there's no book. I'm trying to think. I want to make it. There's certainly no political autobiography or political book that I ever want to read. They're literally the worst books ever written. Is there any autobiography? Yeah, they're like rock star autobiographies. Those are good ones. Yeah, and they can get a good ghostwriter, but certainly not The reason a politician's autobiography book is never going to be good is that, what makes a book good is authenticity and pursuit of truth. What makes a political book, it's just a prop that you can use to sort of establish yourself and get some back-end royalty revenue. It doesn't really serve that purpose. It's not pursuing truth. And so nobody wants to read a book that's just not in pursuit of truth. And that's the biggest category. But it is plagiarized, okay? It's a lot of And Claudine Gay, the president of Harvard, I've done videos on this. She's the president of Harvard, and she only wrote 11 papers. I was like, come on. We have fucking med students who've written more papers, okay? And then half her papers had plagiarism. That's so bad. It's just so bad. You basically made the president of Harvard somebody who's not really a scholar, like somebody who doesn't meet the standard of being a scholar. And that's so bad. That's really, really bad. I don't know what to say. All right, well, I'm in a business where you don't plagiarize. It's obvious you don't even plagiarize your own work. Famously, Brian Rinne, I think you can pull it up on the Oncologist. I'll be very careful. There was an article of his that was retracted because it strangely looked like another article that their group had done. So whatever might have happened there, but they definitely got that article pulled because there's copyright too, okay? Somebody owns the copyright, and you can't just keep writing the same shit verbatim. And it ain't hard to change it up. Just change a few fucking words. How hard is this? It's not hard to change it up. It is really not hard to change it so that it is a different text. It's not hard to say some of these things in different ways. Okay, I don't know what to tell these people. All right. Well, last on my thing it's an ecological study. I don't know. Do I even want to get into it? There's always a debate on prostate cancer screening. I don't think I've ever done a prostate cancer screening video, but you can see my videos on mammography and lung cancer screening. And it's debated because there are these randomized trials, and they have, in my opinion, overall, if you put them all together, they're completely negative for all-cause mortality, which is a pretty damning indictment of an intervention on healthy people. And they have pretty shitty data. A lot of people have to get their prostate whacked out so that one person might have a death from prostate cancer averted. But what is a death from prostate cancer? How is that coded? Is there differential misattribution there? Is there differential loss to follow-up and some issues in these studies? Sure. So we debate this topic. Then I see some group has a paper out in some like third-tier urology journal, and it says an analysis of county-level PSA screening data shows that counties with more PSA screening had less prostate mets and death. Ergo, it works. Well, if you do an analysis not based on individuals who got screened, but counties where there was more screening, we call that in science an ecological analysis. And ecological studies are the absolute lowest form of science that's ever existed. It's a completely shitty study. It's a completely shitty study. It can hide even a paradoxical relationship, a Simpsons paradox relationship, where it is, in fact, even though the counties that score less have the most recurrence, it's actually the individuals who did the most that had the most recurrence. It's very likely there's a Simpsons paradox or something like that in the study. Be that as it may, these studies are just absolutely piss poor. And then they put some tweet out like, this is reinvigorating the debate about screening. No, it's not. It's only reinvigorating the debate if you're an idiot. And if you're an idiot, you should have been hired by Santa Clara County to be setting their mask requirements. You shouldn't be in the field of urology. There's a better role for you. It's called public health, and they want you. All right. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. I'll be back with more videos. Follow me on all these platforms. and let me know if you have suggestions for what to. Okay, one thing. If you suggest an article that everyone is talking about and it's in like a good journal like The Lancet, I'd like to review that article. If you suggest an article like, oh, why don't you do a video on some article from some 7th tier journal that no one reads? No, of course I don't want to do a video on some shitty article that no one's reading. Okay, so if you suggest something for me to cover, let's at least agree it should be something that is impactful, that people are hanging their hat on. And nothing, and it can't be from a journal where the journal author's own mother won't put it on the refrigerator. Okay, it can't be that bad. Okay, it has to be better than that. All right, I'll be back. I should do a video on my paper in the Annals of Internal Medicine with Tracy and Ambarish and others that overturned that masking study. I think that'll be a good one. And that's it. I'm off to give more talks soon. More talks. How lovely. Who doesn't like to fly? Sit in that terrible airplane. Sit in that terrible airport. The terrible Uber ride from the airport to the venue. Sit there, give the talk, and then immediately return back because who doesn't know? Okay, all right. Until next time.